Guest speaker, our respected principal ma'am, our faculty, and all the students. I hope everyone has joined with us. Am I audible to everyone who already virtually have joined? Am I audible, sir? Okay, sir. Thank you. So, as we know that we celebrated the Eating Disorder Awareness Week, so which we aim is to spread the awareness about the eating disorder, how it impact on people, not only in the physical ways but also with the emotional and overall well-being. So, eating disorder, the stigma, and empowered recovery is a topic for these sessions today. So, it is my pleasure to welcome our versatile speaker or resource person for this event. So before we proceed and start our webinar, I just want to give a brief introduction about Sir to our audience. So Sir, Dr. Professor Deepak Santilya, currently working as a principal in Abhilashi College of Nursing, Himachal Pradesh. Sir has done BSc Nursing from Jivaji University in 2007, followed by MSc Nursing in Mental Health Specialty from Maharishi Markendreshwar University, Haryana in 2010. Sir had also done MBA in the Hospital Administration from Jaipur National University in 2021 and followed by PhD in Nursing from NIMS University, Jaipur 2023. Sir is having more than 15 years teaching and administrative experience. He had supervised and trained student nurses in different mental hospitals as his specialty is mental health. In India, like Indian Institute of Behavior and Allied Sciences, Delhi, Central Institute of Psychiatry, Ranchi, Institute of Mental Health and Hospital, Agra, Ranchi Institute of Neuropsychiatry and Allied Sciences, Ranchi, and Vidyasagar Institute of Mental Health and Hospital, Amritsar. Sir has published more than 20 research articles in national and international journals. He has 3 patents approved by the Indian Patent Cell, Government of India. He has published 3 books and also chapter in Target High Book. He also reviewed many other books. Sir has presented more than 10 research paper and poster, has organized 6 workshops and conferences. Sir has attended more than 60 workshops and conferences as a resource person, chairperson, and moderator. He is an associate editor in many national and international journals. Sir also has served as a state nursing council inspector, nursing advisor or expert in many universities and colleges in North India. Sir already also hold various positions: President of the Nursing Teacher Association of India, Secretary of Nurses Scholar Society in Punjab branch, Board member of Global Foundation for Nursing Profession and Social Service. Sir also served as an examiner, paper setter, thesis evaluator in many universities of India. Sir also hold an active membership in TNI and also Indian Society of Psychiatric Nurses. They received many awards and appreciation in the field of nursing education, nursing research, and social service from different university, district, and state authorities. Not only nursing, but also Sir also participated in various sports like cricket, badminton, and chess in a state level. So I welcome you, sir, on behalf of the Samarpan Institute of Nursing and Paramedical Sciences. So the session is over to you, sir. You can proceed with your presentation, sir. Thank you very much, ma'am, and a very warm welcome uh, to management and the principal of Samarpan College of Nursing and the staff and their students. As we are now celebrating the eating disorder awareness week from 26th February to 2nd March 2024. On that, today we are having a topic regarding the eating disorder, its stigma and discovery. इसके clear किया बस में yeah, clear आप क्या है? The PPTs are visual there, sir. Not visible. Right now it's visible, sir. Please make it on full screen. Okay. Okay. Yeah. Yeah, it is visible now. Yes, sir. Please continue. Thank you. Okay. So today we are talking about the eating disorders, stigma, and the recovery. As we all know that as we are the nursing persons, that eating disorder actually relate with the mental illnesses. But many of the peoples are not knowing about these things. They are thinking that it is somehow related with the physical health actually. So it is our main aim that we aware the people regarding the disorders, because when it will come under that, then you will know that it is a second last that is cause in the mental disorders after the opioid overdose. So it is very important to know about the eating disorders and how it relate with the mental illnesses. So we continue with the eating disorders. Here's the image, and this it is written there. Look in the mirror. What do you see? Is it the real you or just another me? I think that you better understand about it, that the persons with their emotions or feelings strict with their eating pattern, that is comes under the eating disorders. The person itself don't want to be him actually. He want that he is just going to see the other person's lifestyle or the body or his physical structure. So eating disorders, there's the introduction. The eating disorders. The eating disorders are complex conditions that arise from a combination of long-standing behavior, emotional, psychological, interpersonal, and social factors. All the mental, social, psychological, interpersonal, and social factors involved in this. Eating disorders are a range of psychological conditions that cause unhealthy eating habits to develop. It starts with an obsession with food, body weight, or body shape. In the severe cases, eating disorder can cause serious health consequences and many even result in death if left untreated. In fact, eating disorder are among the deadliest mental illness second to opioid overdose. Means it is that much severe, and it's only when the person actually become the control of the another's perception. What the eating disorders? People with the eating disorders often use food and the control of food in attempt to compensate
feeling and emotions that may otherwise seem overwhelming. For some writings, binging and purging begins as a way to cope with painful emotions, feel in control of one's life. But ultimately, these behaviors will damage the person's emotional health, self-esteem, and sense of competence and control. आप आप जैसे कि जानते हैं कि हम पेनफुल इमोशंस फीलिंग्स के हमें किसी एक्ट्रेस के जैसा या किसी एक्टर के जैसा या किसी भी पर्सन के जैसे दिखना है उसकी तरीके की बॉडी वेट इतनी या हम अपने सोच लें मेरा जो बॉडी वेट है या मेरी जो बॉडी है वो बहुत गंदी है खराब है अच्छी नहीं है तो उसको देख के हम माइंड में हम हमारी फूड हैबिट्स को कंट्रोल कर लेते हैं या उसको डिफरेंट कर लेते हैं इस कारण हम एक अनहेल्थी पॉइंट पे आ जाते हैं
Evening, sir. Is it audible to you? So you are not audible to us.
मैं ऑडिबल नाउ
Yes, sir. Right now you are audible. Please continue the program, sir.
okay so we are here in the you understood that PPT has completed at the time of the I disconnected that PPT is ordered.
So you can continue the PPT, sir.
So common causes of the on this PPT na cause Yes, sir, please. Yeah. Common causes of the eating disorders. The genetic is the main cause of the all mental illnesses. Uh, Same in the eating disorders. Like genetic cause, there's the monozygotic twins are more prone to this disorder than the dizygotic twins. Second, disturbance in the hypothalamic functions or the brain functions. Here the changes in the neurotransmitters. Then in the social factors also influences like mass media influences. Again, individual psychological factors like disturbance in the body image, low self-esteem, obsessive compulsiveness comes under the psychological factors that influence the eating disorders. Then the faulty family relationship and overprotections like faulty mother-child relationship also influence or the cause of the eating disorder. Then the common sign and symptoms of the eating disorders. There are the two type of the sign and symptoms we are discussing here: mental and behavioral signs and physical signs. As different types of the eating disorders have the different symptoms, like the anorexia nervosa, there are the some specified symptoms. Bulimia nervosa, there is also some specified symptoms. But we are here discussing with the common symptoms of the eating disorders, and the mental and the behavioral sign and symptoms are includes the dramatic weight loss and excessive exercising, preoccupation with weight, food, calories और dieting. Like हम पहले से ही अपने आप को डिसाइड कर देते हैं किसी को देख के कि हमें अपने वेट को इतना ही रखना है, इतना खाना, इतनी ही कैलोरी में खाना है या डाइटिंग करनी है. कंसर्न अबाउट द ईटिंग पब्लिक, बहुत से लोग देखे होंगे, बट मैंने ये कह रहा इट इज दे कम्स अंडर द ईटिंग डिसऑर्डर्स, बट इट कैन लीड इफ इट बिकम द एक्सट्रीम. लाइक बहुत से लोगों के सामने या सबके सामने खाना नहीं खाते हैं. डिनाइंग फीलिंग हैंग्री एंड रिफ्यूजिंग टू ईट सर्टेन फूड्स. ये भी बच्चों में देखा होगा कि सिर्फ यही चीज खानी है और दूसरी चीज नहीं है तो वो खाना नहीं खाएंगे उस टाइम पे. अगर ये लॉन्ग रन जाता है या एक्सट्रीम लेवल पे जाता है तो इट कैन कोज और इट कैन लीड टू द ईटिंग डिसऑर्डर. These are the some symptoms like excuse to avoid meal time and intense fear of weight gain or being fat. Then dressing in the layers to hide the weight loss. बहुत सारे कपड़े पहन लेना कि भाई मेरा weight loss ना दिखे. Severely limiting and restricting the amount and type of the food consumed. Expressing a need to burn off calories. Repeatedly weighing oneself, अपना वेट चेक करते रहना बार बार कि बढ़ा तो नहीं या कहीं ज्यादा नहीं हो गया हो. Patterns of binge eating and purging. Developing rituals around food, like अपना एक फिक्स कर लेना कि मेरे को तो इस तरीके का फूड खाना है या इस टाइम पे ये वाला खाना खाना है, इस दिन ये वाला खाना खाना है, इस दिन इतना खाना खाना है. एंड मेक इट जस्ट ए रिचुअल अपने आप को कि मेरे को ये बॉडी की शेप इतनी ही रखनी है या मेरे को फैटी नहीं होना, इसके कारण एक रिचुअल बना लेना. Cooking meals for the others without eating. Missing menstrual periods. So these are the some symptoms or the signs which comes under the mental behavior. Then there are some physical signs and symptoms that includes stomach cramps and other gastrointestinal symptoms like stomach ache, difficulty concentrating, atypical lab tests results like anemia, low HB level, low thyroid level, low cortisol level, low potassium, low blood cell count, low heart rate. Then dizziness, fainting, feeling cold all the time. These are all the some physical signs actually because they are not eating foods properly, which is required by their body. So sleep irregularities, menstrual irregularities, swells across the top of the fingers joints. In the binge eating or in the bulimia nervosa, most of people is doing the pulsing और इंडक्टिंग वॉमिटिंग भाई वो अपने फिंगर्स को मुंह में डाल के इंडक्टिंग वॉमिटिंग करते हैं तो उसके कारण एक लेयर सी बन जाती है तो उस तरीके का लेयर दिखने लग जाता है फिंगर्स पे ड्राई स्किन ड्राई एंड थिन नेल थिनिंग हेयर मसल वीकनेस और पुअर इम्यून सिस्टम फंक्शन these are all the some common signs and symptoms of the eating disorders. Now, what are all the eating disorders? There are the mainly we are seeing or we read that there are the two or three type of the eating disorders in many books like anorexia nervosa or bulimia nervosa. Sometimes binge eating disorders. But there are the some another types of also this eating disorders. So we will also discuss about it. First is anorexia nervosa. Second one is the bulimia nervosa. Then binge eating disorders, pica, rumination disorder, avoidant restrictive food intake disorder, other eating disorders that includes purging disorders, night eating disorders, other specified feeding or eating disorders. Anorexia nervosa. First we will discuss about the anorexia nervosa. Anorexia nervosa. Those with the anorexia nervosa have a distorted body image, causing them to see themselves as overweight. Even when they are dangerously thin, they refuse to eat, exercise compulsively, and develop unusual eating habits, such as refusing to eat in front of the others. That we already discussed about. कि लोग ये सोचते हैं कि उनकी बॉडी वेट बढ़ ना गया हो या उनकी बॉडी की शेप कुछ खराब ना हो गई हो बहुत ज्यादा फैट ना हो गया हो जबकि वो बहुत पतले होते हैं लेकिन फिर भी इसके कारण इस सोच के कारण वो खाना या तो छोड़ देते हैं या फिर जो अपनी ईटिंग हैबिट्स है उनको चेंज कर देते हैं लाइक लोगों के सामने खाना नहीं खाना या खाने के टाइम पे खाना नहीं खाना इसके की वो हैबिट्स करते हैं एनोरेक्सिया नर्वोसा इज characterized by specific behavior and psychological symptoms and significant somatic signs. Another definition that anorexia nervosa is defined by the restrictions of nutrients intake relative to requirements that we are already discussed जो हमारी बॉडी को जरूरत है जितने न्यूट्रिएंट्स की उतना हम नहीं लेते हैं which leads to significantly low body weight. An eating disorder characterized by self-starvation due to a fear of gaining weight. Then bulimia nervosa. In bulimia nervosa, mainly person binge eating करता है जो मैं आपको जनरल बताना चाहता हूँ और उसके बाद उसको ऐसा लगता है कि मैंने बहुत ज्यादा खा लिया है तो इसके कारण मेरा कहीं बॉडी वेट ज्यादा ना हो गया हो या मेरी बॉडी में कोई प्रॉब्लम ना हो गई हो या किसी तरीके का शेप मेरा खराब ना गया हो तो वो एक इंडक्टिव वॉमिटिंग करता है या पर्जिंग करता है So, bulimia nervosa is characterized by the episodes of binge eating followed by feeling of guilt and depressed. Frequently whinging, that is actually in the consuming abnormally large portion of food within a specific period. Like within a 2 hours, he will eat more foods. Involving recurrent use of the compensatory measures such as self-induced vomiting, use of diuretics or laxatives, dieting and fasting. अभी आज खा लिया या ज्यादा खा लिया तो शाम को नहीं खाना. That comes under the bulimia nervosa. One thing is also I want to say that in the anorexia nervosa there is also two types. In the many books or the many authors says there is the restrictive type or binge eating type. In the restrictive type the patient is not taking food or binge eating type, he is taking food but going for the inductive vomiting or the list vomiting. In the bulimia nervosa, there is also a cycle. Bulimia nervosa, there is also a beans purging cycle in the bulimia nervosa. Here it starts with the strict dieting. The person thinks that मुझे नहीं खाना है. Then it creates a tension to that person that leads to the binge eating. वो फिर खाता है और काफी खाता है. That leads to purging to avoid the weight gain. जब वो खाता है उसको ये लगता है कि मैंने ज्यादा खा लिया है और मेरा weight gain ज्यादा हो जाएगा. And it then it leads जब वो purging करता है then it leads to the shame. Yes. So it is a cycle of the bulimia nervosa. Cycle comes under the bulimia nervosa and is called as the beans and the purging cycle. There are severity in the bulimia nervosa also mild, moderate, severe and extreme. Average of the 150 episodes of inappropriate compensatory behavior per week comes under the mild bulimia nervosa. Then the moderate bulimia nervosa means the episodes are more than or it leads to the 4 to 7. Severe bulimia nervosa has the 8 to 30 episodes in a week. Then extreme bulimia nervosa, there's the 14 or more than 14 episodes in a week. Then binge eating disorder. Binge eating disorder, it is I think you understood the picture. It is characterized primarily by periods of uncontrolled, impulsive or continuous eating beyond the point of feeling comfortably full. While there is no purging, repetitive diet and often feeling of shame, people who overeat compulsively may struggle with anxiety, depression, and loneliness, which can contribute to their unhealthy episode of binge eating. Body weight may vary from normal to mild, moderate or severe obesity. तो बींज ईटिंग इसके अंदर कोई रिस्ट्रिक्शन नहीं करते हैं या पर्जिंग नहीं आती है. दे ओवर ईट एक्चुअली. Then the another pica or pica. Pica, that we all know that the nutrients जो हम खाते हैं जो कि न्यूट्रिशनल नहीं है हमारी बॉडी के लिए, उनको खाना या उनको ईट करना पिका कहलाता है. मोस्टली इज कॉमन इन द चाइल्ड्स. पिका इज एन ईटिंग डिसऑर्डर दैट इन्वॉल्व्स ईटिंग थिंग्स दैट आर नॉट कंसिडर्ड फूड and that do not provide nutritional value. Individual with pica crave non-food substances such as ice, dirt, soil, chalk, soap, papers, hair, cloths, wools, pebbles, or laundry detergent, etc. Non-eatable things are eaten by the person. Pica can occur in adults, children, and adolescents. It is most frequently seen in the individuals with conditions that affect daily functioning, including intellectual disabilities, development conditions. Then another eating disorder, that is rumination disorder. Rumination disorder is another newly recognized eating disorder. It describes a condition in which a person regurgitates food they have previously chewed and swallowed, rechew it, and then either re-swallows it or spits it out. यानी कि जो उसने पैक्ड फूड खाया है, च्यूप किया है, उसको वापस निकाल के उसको दोबारा से च्यूप करता है. इस तरीके का एक डिसऑर्डर होता है और इसके कारण उसको सेम बहुत फील होती है. दिस disorder can develop during infancy, childhood or adulthood. In infants, it tends to develop between 3 and 12 months of age and often disappear its own. Children and adults with the condition usually requires therapy to resolve. If not resolved in infants, rumination disorder can result in weight loss and severe malnutrition. Then, avoidant restrictive food intake disorder, ARFID. It is a name for an old disorder. Previously, it is known as the feeding disorder of infancy and early childhood. And it is comes under the age of 7 or below the age of 7. Under the age of 7. It is also defined that individuals with this disorder experience disturbed eating due to either a lack of interest in eating or a distaste for certain smells, taste, color, texture or temperature. बहुत से बच्चों के अंदर देखा होगा कि वो नहीं खाते हैं, ये उनको इंटरेस्ट नहीं है खाने में, या इंटरेस्ट क्यों नहीं है, क्योंकि उनको वो चीज पसंद नहीं है. मैगी ही खानी है, मैगी नहीं है तो नहीं खानी है, या फिर वो किसी चीज का मिर्ची नहीं खानी है, या मीठा नहीं खाना है, मीठे का टेस्ट पसंद नहीं है, तीखा नहीं खाना है, या किसी येलो कलर का नहीं खाना है, व्हाइट कलर का कोई फूड है वो नहीं खाना है. तो इस तरीके से वो अपनी जो ईटिंग हैबिट्स है उनको डिस्टर्ब कर लेते हैं. देन other eating disorders. In the other eating disorders, there is the purging disorders. Individuals with the purging disorder often use purging behaviors such as vomiting, laxatives, diuretics, or excessive exercising to control the weight or shape. However, they do not binge. खाते नहीं है ज्यादा, लेकिन जो भी खाते हैं नॉर्मल खाते हैं उसको भी पर्जिंग आउट करते हैं. Night eating syndrome. The term defined by its topic. Individuals with this syndrome frequently eat excessively at night, often after awaking from sleep. सोते हुए रात को जग के फिर उनको खाना खाने का मन करता है, most of persons में. Then other specified feeding or eating disorders. While it is not found in the DSM-5, this category includes any other conditions that have symptoms similar to those of an eating disorder but don't fit of any of the particular eating disorders. मतलब इनके जो सिम्टम्स है वो एनोरेक्सिया नर्वोसा से भी लगेंगे लेकिन वो एक्चुअली नहीं होता है. सिम्टम्स हो सकता है बुलिमिया नर्वोसा जैसा भी हो लेकिन वो बुलिमिया नर्वोसा भी नहीं है. तो इस तरीके का एक डिसऑर्डर है ये. अभी ये DSM-5 में आया नहीं है, लेकिन ये भी एक other specified feeding or eating disorders. One disorder that may currently falls under OSFED is orthorexia. Orthorexia is increasing maintained in the media and in specific studies. The DSM does not yet recognize it as a separate eating disorder. Orthorexia is also a eating disorders. Then individuals with the orthorexia to have an obsessive focus on healthy eating to an extent that disrupts their daily lives. They may compulsively check ingredients list and nutritional level and obsessively follow healthy lifestyle accounts on the social media. जो भी लोग बाहर के करते हैं या सोशल मीडिया पे कोई इस तरीके के हैं, उस तरीके बट पर्टिकुलरली ये इंग्रेडिएंट्स उसके अंदर है तो खाएंगे, अदरवाइज नहीं खाएंगे. तो इस तरीके का एक डिसऑर्डर है जिसको ऑर्थोरेक्सिया कहते हैं. ये अभी रिकॉग्नाइज हुआ है. देन द अनदर पॉइंट दैट इज द स्टिग्मा और मिसकंसेप्शंस रिगार्डिंग मेंटल इलनेस हमने पहले पढ़े भी हैं या सुने हैं. सेम ही कुछ मिसकंसेप्शंस हैं ईटिंग डिसऑर्डर्स के बारे में. So we are discussing about the stigma. First of all, what is the stigma actually? Stigma is the experience of shame, discrimination, or social isolation of a person due to a particular characteristics, condition, or attribute. There are several types of the stigma associated with the mental health condition, such as eating disorders. These can be defined broadly to include public stigma, like लोग क्या कहते हैं, लोग क्या सोचते हैं, या लोग क्या बोल रहे हैं. Structural stigma, self stigma. Then stigma and eating disorder. What are the actual misconceptions or myths regarding the eating disorders we are discussing here? Some common myths and the misconceptions about the eating disorders includes eating disorder are not serious. They are lifestyle choice. Most of persons think like that. That it is not a serious thing. इट इज अ लाइफ स्टाइल चॉइस. किसी को क्या पसंद है इसलिए वो ऐसा खा रहा है, किसी को ये पसंद नहीं है इसलिए वो नहीं खा रहा है. बट ट्रुथ जो है दैट इज द ईटिंग डिसऑर्डर आर सीरियस and potentially life threatening mental illness that we already discussed, that it is the second death cause in the mental disorders. Then there is another myth, dieting is a normal part. मीन्स इट इज अ नॉर्मल पार्ट ऑफ द लाइफ. डाइटिंग हर कोई करता है कि ये तो नॉर्मल पार्ट है लाइफ का. बट अगर एक्सट्रीम है तो ये प्रॉब्लमेटिक है. द ट्रुथ, ईटिंग डिसऑर्डर ऑलमोस्ट invariably occurs in people who have engaged in dieting or disorder eating. Dieting is also associated with other health concerns including depression, anxiety, nutrition, and metabolic problems. Then another myth is that is related to the eating disorder. That eating disorders are a cry for attention or a person going through a phase. Attention seeking के कारण वो नहीं खा रही है या नहीं खा रहा है. लोगों के सामने हम मना कर देते, नहीं नहीं मैंने तो खाया है, मैं यूजुअली वो चीज ठीक है. बट अगर वो डिसऑर्डर में आती है, एक्सट्रीम में आ रही है, तो अटेंशन सीकिंग लोग सोचते हैं कि अटेंशन सीख करने के लिए ऐसा बोलते हैं. But it is not an attention seeking disorder. Another myth related to the eating disorder, that families, particularly parents, are to blame for the eating disorders. There is no evidence that the particular parenting styles are a direct cause of the eating disorders. बच्चों को भाई तुमने स्टार्टिंग से खिलाया नहीं है इसीलिए ये अब नहीं खा रहे हैं, या इनको ये खाने की आदत नहीं है, ऐसा लोग सोचते हैं. बट ऐसा नहीं है, इस तरीके का कोई भी रिसर्च नहीं आई है. Then the eating disorder only affect while middle class females. Eating disorders only affect white middle class families, particularly adolescent girls. But truth is that eating disorder can occur in the people of all ages and genders across all socioeconomic groups and from any cultural background. ऐसा नहीं है कि पर्टिकुलरली गर्ल्स में होता है, पर्टिकुलरली मिडिल क्लास फैमिलीज में होता है, या लो क्लास फैमिलीज में होता है, या पर्टिकुलर किसी एज में होता है. ये किसी भी एज में और किसी भी तरीके के स्टेटस में ईटिंग डिसऑर्डर हो सकता है. Then the recovery from the eating disorders. The true recovery from an eating disorders involves learning to listen to your feelings. आप दूसरों को देख के, दूसरों को फील करके, या अपने इमोशंस में अपने आप को कंट्रोल ना करें, अपने फीलिंग्स को सुने. इम्पोर्टेंट, आपको पता है कि आप बहुत थिन हैं या आप उतने न्यूट्रिएंट्स नहीं ले रहे हैं जितने आपकी बॉडी को जरूरत है, फिर भी आप उसके अकॉर्डिंग चल रहे हैं, इट लीड्स टू द डिसऑर्डर. सो यू लिसन योर बॉडी, क्या रिक्वायरमेंट है बॉडी की. एक्सेप्ट योर सेल्फ, आप जैसे हैं उसको एक्सेप्ट करो. उसके बेस पे, किसी के कहने पे या किसी की बातें करने पे आप ओबीज हो, मोटे हो, फैट हो, और इस पॉइंट को लेके आप अपने आप में शेम फील करो या अपनी हैबिट्स को चेंज करो, ऐसा नहीं. एंड लव योरसेल्फ, whatever you are, you love yourself. Recovery continues. There are some tips to recover from the eating disorders. The first one is know your treatment options, which may include any combination of the following or all. सबसे पहले अपने ट्रीटमेंट के ऑप्शंस को चुनो. क्या है? न्यूट्रिशनल थेरेपी है. इफ यू नीड न्यूट्रिशनल थेरेपी, देन गो फॉर द न्यूट्रिशनल थेरेपी. डायटिक्स के पास जाना, डायटिक्स से प्रॉपर थेरेपी लेना, वो आपको बॉडी वेट के हिसाब से आपको एक मील सजेस्ट करेगी, उसके अकॉर्डिंग जाओ. देन साइकोथेरेपी, दैट इज मस्ट, बिकॉज इट इफेक्ट्स ऑन द मेंटल illness, mental health also. So there, for the eating disorder, we can go for the individual therapy, behavioral therapy, CBT, or family therapy mainly. Medications in the eating disorders, the mainly medications used at the neuroleptics, appetite stimulants, then antidepressants. Partial hospitalization. Yeah, आप घर पे हैं, डेली हॉस्पिटल विजिट करके डॉक्टर से कंसल्ट करके आप अपने डिसऑर्डर को ओवरकम कर सकते हैं. एंड द हॉस्पिटलाइजेशन, दैट इज आल्सो इफ इट इज इन द सीवियर फॉर्म. if the disorder is in the severe form, then it is compulsory to be hospitalized. Then second, use positive self talk. अपने आप से बात करो, और पॉजिटिव, ये नहीं कि उसका ऐसा है, उसकी शेप इस तरीके से है. जीरो फिगर आया था कुछ साल पहले करीना कपूर का, तो बहुत से लोग उस पर चले गए थे कि हाँ उस तरीके का करना है. नो, यू सेल्फ टॉक, गो फॉर द सेल्फ टॉक. अंडरस्टैंड योर ईटिंग डिसऑर्डर्स रूट. क्या है एक्चुअल, क्यों आप ईटिंग डिसऑर्डर में जा रहे हो, किस तरीके के ईटिंग डिसऑर्डर में आप जा रहे हो, उसका एक्चुअल रीजन क्या है, कहां से स्टार्ट हुआ. देन एक्सेप्ट सपोर्ट फ्रॉम लव्ड वंस. आपको कोई सलाह देता है, आपका भाई, आपके माता पिता या कोई भी, आप उस सपोर्ट को एक्सेप्ट करो. देन प्रैक्टिस सेल्फ केयर. अपनी केयर खुद करोगे तो पता लगेगा कि मेरी बॉडी को क्या रिक्वायरमेंट है, मुझे क्या खाना चाहिए, क्योंकि वी आर टॉकिंग अबाउट द ईटिंग डिसऑर्डर. तो ये सेल्फ केयर इज टोटली रिलेटेड टू द ईटिंग. तो क्या खाना है, कब कब खाना है, ताकि मेरी बॉडी हेल्थी रहे. बिलीव्स यू आर वर्थ इट. लाइक आप जो भी कदम उठा रहे हो अपने डिसऑर्डर को ट्रीट करने के लिए, अपने आप पे बिलीव करो. उसके लिए आपको फाइनेंशियली, सोशली, साइकोलॉजिकली जो भी नीड है वो आप एक्सेप्ट करो. देन स्टे ऑप्टिमिस्टिक. या confined in trusted friends and family. Be patient. लिसन टू योर ट्रीटमेंट टीम. जो भी आपके डॉक्टर्स हैं या बाकी ट्रीटमेंट टीम है, जो भी आपको सलाह देती है, टाइम टू टाइम विजिट है, फॉलो अप है, उसको सुनो और उसको फॉलो करो. एंड फेस योर फियर्स. अपना जो भी डर है, जो भी एंजाइटी है किसी भी तरीके की, उसको फेस करो. There are some common tips for the recovery of from the eating disorders. Then stages or phases of recovery. There are some stages, or we can say the phases of recovery from the eating disorders. In that, first one is the pre-contemplation phase. Here, the another person can observe you that you are having somehow disturbances in the eating pattern, or you are going for you are uh, uh, going to eating disorder. Like close family and friends may notice the symptoms and behaviors of an eating disorder, but you may still think that you do not have a problem or need help. Then second, the contemptation means now you are willing to admit that you have an eating disorder and need help. However, you are fearful of changes. अपने आप को विलिंगली एडमिट करो कि हाँ मुझे भी ऐसा लगता है कि कुछ ना कुछ प्रॉब्लम आ रही है, अगर कोई कह रहा है तो उसको ऑब्जर्व करके इस चीज को देखें. देन प्रिपरेशन, you are already to make a change, but you are not sure how or what to do. When you are going in the preparation phase, आपको पता है कि मुझे कुछ ना कुछ चेंज करना है, जो चल रहा है वो गलत चल रहा है, तो लेकिन कैसे करना है और क्या करना है. Then comes in the action. You begin to make change following the recommendations of your care team. Like जो भी आप डॉक्टर से कंसल्ट कर रहे हो या थेरेपिस्ट से कंसल्ट कर रहे हो, उसको फॉलो करो, उससे कंसल्टेशन करो और उनको कंटिन्यूशन एक्शन में लेके आओ. देन मेंटेनेंस, यू हैव सस्टेन्ड चेंज फॉर 6 months और मोर. अगर आप उसको फॉलो करते हो तो 6 महीने में या 6 महीने के अंदर आप में बहुत सारे चेंजेस हैं जो आ जाएंगे. You are working with your team to create strategies to maintain changes and prevent the relapse. So these are all some stages or phases of the recovery from the eating disorder. So this was some we had aware or we got some discussion about the eating disorder, the types of the eating disorders, their causes of the eating disorders, sign and symptoms of the eating disorders. Then what are all the myths or the misconceptions regarding the eating disorders or its recovery? I think you will understand what I deliver. If there is some questions you can ask from me. Ma'am? Yes, sir. Yeah. If there is some question or anything discuss. Yes. Harsh, can you please mute yourself? Students, is there any question from your side? एक्चुअली सर हमारे जितने भी स्टूडेंट्स हैं समर्पण की वो सब ऑडिटोरियम में बैठे हुए हैं, शायद आपको व्यू में दिख रहे होंगे. हाँ मेरे को दिख रहे हैं. हाँ सर, majority of students are sitting there in the auditorium sir. Remaining का हमारा YouTube लिंक ऑलरेडी शेयर किया हुआ है और आपको भी actually the mean of this lecture is only to aware about the eating disorders or the recovery or stigma mainly. So I made myself whatever I can deliver. So if there is anything there to ask, then you can ask related this. Yeah, sure, sir. फ्रेंड्स आप में से किसी को कुछ सवाल करना है तो प्लीज आ जाइएगा सामने. सुशांत सर.
Yes, ma'am. If you make it, go ahead.
सर सर किस
Approximately, sir, I have one question. What is the difference between overeating and binge eating?
it is somehow same. Binge eating is only overeating in a particular time period, but overeating is always. Like in the 2 hours, within the 2 hours, the person is eating more and more. That is the binge eating. Thank you.
Anyone else? Okay, people do that? Arthur?
So, ma'am, it is somehow I delivered, and you can take the Very good evening. Yeah, I discussed there's a treatment. We can go for the medications because from the mental illnesses side, we can go for the antidepressants or neuroleptics. We can go. And now over to you.
Is there anyone left? Then offer answers, answer. Okay, sir. Thank you. So, sir, it's our great privilege that you are today